Diabetic footwear. Now, a lot of diabetics sometimes have ulcers, amputations, and one of the things that prevents an ulcer from healing quickly is the pressure on the ulcer. And of course, there are certain types of footwear that are available that will allow you to take pressure off the ulcer. And for example, one of these shoes here, this is one of the diabetic healing shoes. In fact, also if you have a fractured toe, you can wear this shoe. Now, if you look at the shoe here from the side, you can see that this is curved. When it is on the floor, this part here is actually off the floor and the pressure is put quote unquote on the ball of the foot. So this elevates the toes, and if you have a fractured toe or if you have an ulcer under the toe, if you had a toe that was amputated, this will take pressure off the site and will help with the healing process. Now, to additionally make this a bit more effective, there is an insole that you can put into that shoe. You remove the default insole that it comes with, and you have what is called the peg assist system. This is the top part, this is the bottom part. As you can see here, you have pegs here that can actually break off. Okay? So for example, if a person had an ulcer under the big toe, okay? And of course, the design of the shoe allows you to take pressure off the big toe. But for maybe some additional relief, what can be done is that the pegs here can be broken off. And what happens here, it is that it creates a depression. So when you put the toe on the insole, there will actually be less pressure on the toe. And it fits into the shoe, something like this here. Of course, the shoes are available in different sizes. Okay, so that's one of the types of healing shoes we have for diabetics, as well as those who have had a fractured toe or an ulcer under the toe. Okay, so another type of design we have is this type of shoe where the front is cut away. So when you're walking, you actually are putting pressure on the heel of the shoe. So for example, if a person maybe had an ulcer on the ball of the foot, and this would be a great way to take pressure off the ball of the foot, allowing the area to heal. So it comes as a one-sided shoe. You will not be wearing two of these, and there are certain limitations to wearing this particular device. For example, an older person or a person who's very weak and doesn't have the leg strength to actually walk and keep the pressure on the heel, this will not be suitable for them because of the lack of strength in the leg. When they're walking, what's going to happen is that the shoe is always going to keep falling forward, this, okay? And you will keep hitting the front of the foot, and that is not what you want. The person must still have some level of reserve strength, so when they're walking, they can actually put some pressure, they can keep the pressure on the heel or on the back of the foot, thereby offloading the front half of the foot. Also as well, this shoe is not really made for you to be walking doing a lot of walking, because as you can see, it does have some height. Obviously on the next foot, if you're wearing sandals or slippers, you would want that sandals or slippers to have some height to sort of match the height that you have here. Well, you will end up with some back pain if you do a lot of walking with a lot of leg length difference due to the height difference in the footwear. So just keep that in mind. This shoe is when you have it on, you want to still stay home, rest, just do only the essential walking you need. Maybe to go to the washroom, from the washroom to the bedroom and back. So yes, I really would not advise you actually wear this and do a lot of walking. Give the ulcer a chance to heal. So this next device, next type of shoe is, for example, if you had an ulcer on the heel. Okay, so you've had an ulcer on the heel here. What you would do is you would put the shoe on, and as you can see, compared to the one before, where you're putting pressure on the back of the foot, and this one you're putting pressure on the front of the foot. So now you're keeping the heel offloaded. So that will allow an ulcer on the heel to actually heal itself because now you're taking pressure of that part of the foot. So again, these come in different sizes. Okay? So these are just some of the devices that are available for those who have had diabetic ulcers or amputations, fractured toe. Okay? These can help with the healing. They can accelerate the healing in conjunction with other methods. Of course, it is not a standalone system. You still have to take adequate care of your foot and make sure your sugar is under control. Maybe do some honey dressing on the foot as well. So, but keep it in mind that we do have devices that are available to reduce pressure of the ulcers to allow them to heal quicker.